part of our presenting group. We're really glad that all of you are here today for this joint media availability that we're doing with St. Luke's, Saint Alphonsus Health Systems, Valor Health, West Valley Medical Center, Primary Health Medical Group, and Saltzer Health. Again, go ahead and mute your microphones and turn off your cameras if you are not presenting. We'll make sure that once the Q&A opens up, you'll have the opportunity to ask questions. Joining us today, we have a leader from each of the organizations. We have Dr. Patrice Burgess from Saint Alphonsus, Dr. David Peterman from Primary Health Medical Group, Dr. Rob Cavagnol from St. Luke's, Dr. John Kaiser from Saltzer Health, Brad Turpen from Valor Health, Richard Augustus from West Valley Medical Center, and Travis Leach from Saint Alphonsus. So we are going to give you the opportunity to ask questions, and I just want to show you one more time how you can do that in the best way. We have some handy, let me just pull up the graphic for you. At the bottom of your screen in the middle, you'll see the hand raising element there. When you would like to raise your hand, just go ahead and push that and we'll call on you as best we can in order. You can also submit questions via the chat feature, and we'll try to get your questions in order as best we can. So again, there's just highlighting the hand if you want to ask a question and the chat feature if you would like to not do so. So we'll make sure to keep tabs on that and appreciate all the time. So again, just one more quick reminder to go ahead and mute, and we'll get started with Dr. Burgess.
Thank you very much, Anita, and we would like to welcome the media for joining us today. This is our third session that we're having with all the different healthcare entities to try to provide information around COVID-19 and the different issues that are coming up with COVID-19. And I think it's just wonderful to see the cooperation with our healthcare community. We have all different systems that we come from, but our missions are really the same, is to take good care of our patients in the community and to not only take care of sick people, but try to help keep people from getting sick. So that's really the purpose of a lot of what we're talking about today. Today, our main issue that we're going to be talking about is testing, as well as having a safe Labor Day holiday. And testing, as everyone knows, I think has been very challenging, not just here locally, but nationally, even internationally. So we'll be talking about a little of those issues. And we also will talk about lifestyle impact with the Labor Day weekend, as I mentioned. One thing we do want to mention is we want to applaud the governor's task force for looking at expanding testing in our community. So we'll talk a little bit more about that. And each of our CMOs and CEOs will be talking about their individual institutions and what testing looks like in those individual institutions. I was going to start off with St. Alphonsus, which if you can change the slides to St. Alphonsus, that I'll start off with our testing, and then we'll hand it off to each of the other entities. So at St. Al's right now, we have finally gotten some point of care testing. There's been, again, a competition around the country. We had a shipment that we ordered in May, and the government actually will redirect those sometimes to other places in higher need. So we received those last week. It's called the Quidel Sofia. It's an antigen test, best used for symptomatic patients. And the results are available within 15 minutes, but sometimes depending on how many patients are there, it might take a little longer, but at least within the same day. And we're starting to use that at Meridian Health Plaza, which is one of our testing sites, and we'll be expanding it to other sites. This week, we expect to get some of the Abbott ID Now kits, which is a rapid PCR test, and that one will be more available for symptomatic and asymptomatic patients. And then next slide, please. We've always had, since the pandemic began, or at least began in our community back in March, in-house testing that's available for our emergency room patients, our inpatients, and patients for procedures. And those results turn around within 4 to 24 hours, depending on which platform we use. We have several different ones that we can use in-house. And then we do still utilize some outside reference labs. And one of the other parts about testing that I'm sure you'll hear from each of the entities is the criteria of patients that you test. So originally we were testing anybody that wanted a test, whether they had symptoms or not. And around July, that demand hit about 600 to 800 patients a day, which overwhelmed our reference labs that were having slow turnaround times nationally. And so we had to change our criteria to symptomatic patients. And now those results are available in about a 2 to 3 day turnaround. And we'll continue, like everybody, to reevaluate which patients we can test and to make sure that the turnaround time is reasonable. So with that kind of summarizes where we're at right now with St. Alphonsus. I'll turn it over to Dr. Peterman with Primary Health.
Thank you, Pat, and good morning. Good morning to everyone else, and thank you for giving us the opportunity to kind of update you on testing. I'm going to try to be brief, like Pat, so that we can get to your questions. So, Anita, if you can pull up the next set of slides. Okay, yep. All right, so this first slide, and some of you who have been on the press, who have been on the previous call, this is a different graph than I've shown before. This shows us at Primary Health our daily testing for all our sites, which is about 5 sites. And I just wanted to give you a sense that, just like Pat described, earlier in July, when there was an increased demand for tests, our sites reflected that. You can see 400 tests a day, 389. And then as you move to the right, the demand for tests, or the number of tests, decreases. And then as you go all the way to the end, those bars get smaller. I just wanted to make the point that those seeking tests in the community, there's less doing those tests, and that does have an impact in terms of how many positives you identify, and we'll talk more about that. Next slide. So again, you've seen this, those who have been on the call, you've seen me show this slide before. This is the positive rate of our tests per week, and it is both Ada and Canyon County. And of course, what you see way to the left, the positivity rate is below that green bar, which is 5%. I'll talk about that in a minute. But then again, as you get into July, and again, as we all recall, when the bars were opened and people started to circulate, though the positivity rate jumps up quite significantly. And if you go all the way to the right, you can see for our overall, it's been 14%, 14%, 13%, and then this last week it dropped down to 10%. I would make 2 comments. One, we shouldn't jump to conclusions because that's only 1 week. But even if that's the trend, it's a good trend, but the 10% is still very high. And the goal is the green bar. That's what essentially, but experts from around the country and frankly the world, the intention is to get the positivity rate less than 5%. So if we go back to just what I said earlier, less people are being tested, and so report less positive tests. But that doesn't really tell you what's going on in the community. It's the positivity rate which gives you a sense of the incidence in the community. And what our goal is to get it below 5%, which is where we're not there yet. Next slide. Yeah, this just reiterates what Pat has already said, which is, there was so much confusion on tests. The demand was great. There weren't enough available. We had so many questions about accuracy, questions about cost, long wait times, which discouraged people from getting tests. And so at least I think we can all say, again, in the United States, the PCR test is now the accepted as the most accurate. And that's the test in which the hospitals can do in their labs, and then those of us in smaller clinics, we send out. Again, Pat referenced the point of care test, the 50-minute test. Those certainly are useful and available. There's some questions about how accurate they are, but I agree with Pat. They're very helpful and useful, and we at Primary Health do have the Abbott point of care test. I wanted to make the point that the test results depend on timing of the patient's infection. There's now enough data to say that, quote, if you test too early, that could be negative. And then as you go further out from disease, you may have had the disease, but your test is negative. And also, it's been shown that you can go further out, let's say 30 days after your initial symptoms, your test is still positive, but in fact, that may not mean anything. The point being is you're no longer infectious. And so that's my point. The test can be negative if it's too soon, and too late, the symptoms may be resolved. Next slide. So just again, this is really just reinforcing what Pat said. At Primary Health, and I believe the rest of us in the community are following the governor's testing task force recommendations. First of all, we all agree those patients that are symptomatic need to be tested. Second, we absolutely want to focus on high-risk patients, those with chronic diseases, the elderly, and those in high-risk situations, essential workers, those working in convalescent homes, certainly the hospital workers, their intensive care units, our police force. Those people, when there's any question, they absolutely need to be tested because we need them to be doing their jobs. The third is that the testing task force clearly stated, and they based it on tiers, and in their first tier is those patients or those individuals who are asymptomatic, have no symptoms, but have had close contact with confirmed COVID test cases that should be tested. And I'll talk a little bit more about that. And then I wanted to make the point, which again, there's enough data now to say as high as 30, and some even say as high as 40% of the cases may be asymptomatic. And again, we have data that says that children are less likely to show symptoms than the adults. And therefore, it is absolutely essential that we continue to be doing testing and doing testing in those focused manners, particularly those with asymptomatic contacts as we reopen schools, because what has happened, and we've seen this on the news, whether it's the schools in Indiana, schools in Alabama, the colleges, there's unfortunately quite a bit of spread when you open up schools. Next slide. I just wanted to reference, just to clarify this, the CDC came out with this statement, I want to say about a week ago. I'll try to stay away from the politics, but essentially this statement said that there wasn't a need to test asymptomatic patients of contacts. And I want to just say unequivocally, I personally don't agree with that. And I believe the healthcare experts from around the community here and those on this call agree that we need to test those that have contacts that are asymptomatic, because that's our only ability to, in a sense, address the spread, and particularly in schools. Next slide. So just primary health, we have 5 sites that we're testing now. We have approached this with, quote, clean clinics and respiratory clinics, and our respiratory clinics do the majority of our testing. Patients call in, get an appointment. It's curbside, 7 days a week, 12 hours, multiple locations. Again, call ahead, and we now, again, have same-day appointments. We use a lab in Pendleton, and because of our relationship with them, we actually are getting our results back in 12 to 24 hours. About 96, 97% of our results are in 24 hours. But again, there's some of them that can go out 48 or 72 for various reasons. We also do have the point of care test to give you results in 20 minutes or sometimes longer, depending on the weight and how many. We're not actively using that today because we're getting such quick turnaround times with our reference lab. I also wanted to make the point, there's been some apprehension from some of the community members about the swab that gets seemingly stuck all the way back to their throat and uncomfortable. Our approach is we use a swab which is just put in the front of the nose, in a sense, the anterior part of it, just the front. And it's a self-swab technique, so the patient actually does it themselves. from the car while our provider watches them. They swirl it, I believe it's 6 times in each side, and then hand it to the provider. And if they don't want to do it themselves, then the provider will do it for them. And I think that's all the slides that I have, and I'll turn it over to the next speaker.
Thank you, Dr. Peterman. The next speaker is Dr. Rob Cavagnol from St. Luke's. Dr. Cavagnol, can you unmute, please?
How about now? Can you hear me okay?
We sure can. Thank you.
All right, sorry about that. So it's a pleasure to join the other physicians and leaders from across the community to share what we're doing with testing at St. Luke's Health Systems. So we're really encouraged to see the 14-day average positivity rate drop to about 7%, which is what we're seeing here. That tells us that the people in the community are starting to take this seriously and taking measures, which is helping to prevent the spread of this. You know, the measures that we're really promoting are the 3 W's, which is wear a mask, watch your distance, and wash your hands. And we know that the people of the community are the ones who can really help us to get this pandemic under control. Our current capacity, we're seeing challenges just like other health systems are across the country with testing supplies and with getting the appropriate reagents. We're averaging anywhere from 800 to 1,000 tests per day. Anita, if you could pull up that first slide that we have. So just to talk about our turnaround times, we have a prioritization that we use that helps to, you have the informational slides, Anita, that show the turnaround time. So what we've got is some prioritization. So acutely ill patients are with symptoms. Those are the ones that are in the hospital, that are admitted or in the emergency room, you know, that have a direct impact. And we're going to change what we do based on the results of those slides. You know, based on the results of those tests, we have the Abbott ID that gives us a result in 15 minutes or less. And those are our priority 1 patients. The other patients that we consider to be priority 1 are folks who are being discharged to a nursing home or a long-term facility, as well as symptomatic employees. Thanks, Anita. And asymptomatic folks who are going to have a planned procedure. You can imagine if someone's being put to sleep in the operating room, there's the opportunity to really aerosolize the virus. And so those are the folks who we're testing priority 1, and they have about a 1 to 2 day turnaround time for those patients who are either being discharged or having an operation. Priority 2 patients are folks who come in who are symptomatic, and those we're sending to outside labs. We have a little bit of a longer turnaround time on those folks, usually about 3 to 5 days, just because we do have to send the test out and have those run at another location. You know, it's not the optimal timing in our eyes. We're just limited based on our own capacity. So we are purchasing additional equipment to help with our internal testing capabilities, and we will have that this fall, and that will really help with our turnaround time with that testing. For asymptomatic patients, and I know this is a little bit different than some of the other locations, we really aren't offering testing to asymptomatic patients. And so we're having folks come in, if you can go to the, you're on it. We're having folks come in who maybe have a planned trip, or they want to go fishing in Alaska, and the company's requiring them to have evidence of an asymptomatic test. We just don't have the capacity to test those folks. And so we really, you know, we need the community to understand where our focus is, which is on those, you know, the priority 1 and priority 2 folks. You know, with schools opening, there's going to be some outbreaks happening. And so we're working with school districts and other organizations to help them kind of understand what's important and how to manage those. But again, we're not able to offer asymptomatic testing for students or other folks. This is a limited resource that we have, and so we're trying to prioritize it accordingly. And we do have an online symptom checker. If you go to stlukes.org, you can fill out the symptom checker and see if a test is really indicated, if you're symptomatic. But if you don't have symptoms, even though you potentially have been exposed to someone who's tested positive, but if you're essentially asymptomatic, we'd ask you to follow those 3 W's, right? Wear a mask, watch your distance, and wash your hands. And if you do become symptomatic, then you can use that symptom checker to determine whether or not a test is appropriate. If you can go to the next one, Anita, the future of testing. So there's been a couple of new developments on the testing front that we just wanted to touch on that potentially has caught your eye. So there's the saliva test, which is still being developed and refined. And at St. Luke's, we're exploring to see if this makes sense for us and for our community. Really, the patient can provide the sample with provider oversight, or even this can be mailed to people's homes and they can provide a sample that way. Right now, these tests are only being run at certain locations, and so it's a little bit more of a challenge as far as timing, because you do have to mail the specimen to them. And so this is something that we're looking at to see how it's going to fit into our testing strategy, and we have not yet adopted the saliva test. And then the antigen test is another test that has hit the media lately, the new Abbott Now test. It's very inexpensive. They're estimating that it's only going to cost around $5. There's really not much instrumentation that's required. The accuracy is still in question, how accurate that test is going to be, and it's probably going to be valuable for more widespread testing, just to get a sense of what the disease burden is in various communities. So that's sort of the summary of the testing and the future of testing that we see here at St. Luke's. And I'll turn it over to Dr. Kaiser from Saltzer Health.
Thank you very much. So I won't reiterate a lot of the things that have already been mentioned, but just from Saltzer Health, we are using the same criteria that everyone else is, at least Primary Health and Saint Alphonsus, on who we test. We are testing some asymptomatic patients who have close contact because we think that's an important tool for us to help patients know when they should isolate and when they shouldn't. We're also working with several of the local companies to provide these services to help them when they're in need of quick returns on test results. We're working with Idaho Power on some critical staff members that they have that have to be out doing jobs to keep power to different areas, and they'll come to our clinics. We also work with NNU and with some nursing services such as 24/7 professional solutions. We believe that testing is an important part of, if it's done properly and if patients follow through with the correct process of self-isolation. I'd like to show you just what our results have been on the test results. So we'll see if we can pull this up here. So hopefully you can see this. It shows our testing from the beginning, and we have broken it out by counties, gender, and the age that we have tested. Done a total of over 11,000 tests to date, with about 1,400 of those being positive. Similar to what you heard before, we had a significant spike. These are weekly totals in chart A for test results. And if you look at the positivity rate, we were as high as 21% at one point. That rate has dropped up through the week ending 8/16. Unfortunately, we've seen in the last week where we have most of all the data tabulated, an increase back up to 16%, which is a little concerning. And when you look at the data that we have by county, we do most of our testing in Canyon County. And if you look at the positivity rate for Canyon County, it's about 15%. And that accounts for about 2/3 of the tests we've done. Ada County is about 8%. So again, a little concern on that side of the testing results. And we'll continue to monitor that and see if we see any changes. Hopefully with the measures we've taken, that we will start to see a decline in that also. Type of tests we're doing PCR tests, traditional. We use ID Now quite a bit with the special needs that we have, and we've gotten allocations, so we're able to use it a little bit more. So test results are back in 15 minutes. We've talked to Abbott about the antigen test. Unfortunately, it's going to be a long time before that test would be available for us to use in our clinics. So we'll probably stick with the PCR and the ID Now testing. We also have testing available by appointment and walk-in at our 3 urgent care locations in Nampa, 2 in Nampa, 1 in Caldwell, and we have a new clinic opening this Wednesday in South Meridian. We'll be able to do that testing also. That's all the information that I wanted to share about Saltzer Health and our testing. So with that, I'll turn it over to Brad Turpen.
Thanks, Dr. Kaiser. Hello, everyone. My name is Brad Turpen. I'm the CEO at Valor Health. We are Jim County's health system. I'm honored to be here with all these physicians. Wanted to let you know, even though we're serving a small community, we are very connected to Ada and Canyon County. We have a large commuting population, and so a lot of what we're doing is very consistent with what the larger systems are doing. We continue to test symptomatic patients as well as probable patients for certain services, procedures, travel, essential workers, etc., and including those patients who might be transferred from our facility to a larger facility in Boise Meridian or Nampa Caldwell. We continue to do our drive-up screening and testing on our campus. We're doing that 7 days a week, 8 a.m. to 4 p.m. We are also tracking a 30-day positivity rate, and we've seen that rate steadily decline, which we're really encouraged by. Right now, it's at 10.17, and we'll continue to track that. We're weekly meeting with the Emmett School District, trying to help support their reopening plan. And the last point I'd want to make is, we, just like other folks, are encouraged by the trending in the numbers, but know that we're not even close to being out of the woods, and we want to applaud folks who have been doing the right things and following the 3 W's, as St. Luke's alluded to, and just encourage folks to continue to do that. We do have a holiday weekend coming up, which I think Dr. Augustus is going to talk about a little bit more specifically, but really in our community, we're really trying to encourage folks to wash their hands, wear a mask, watch their distance, and all of those things that have helped us continue to see this trend, and we want to keep it going in the same direction. So appreciate the opportunity to speak with you today. I will be available for questions with everyone else, and I'll turn it over to Dr. Augustus from West Valley.
Good morning. I wanted to talk about the Labor Day weekend, since we've heard a lot about testing and I don't have anything there to add. As we go into this weekend, we can do this safely and keep our numbers trending down if we just follow the simple guidance that we've been given. We should go out and enjoy the outdoors. We should do it in small groups. If we're going to be closer than 6 feet with people, we should mask up. If we do that, we're going to see that we can control this and continue to improve. If we don't continue to be vigilant, we're going to see an increase in 2 to 3 weeks, and we're going to be back into trouble again. So I hope that we can, be responsible and manage our time, but enjoy the wonderful weather we're having, get outside and go in small groups and enjoy the weekend. I think our numbers will continue to be good, but we're not out of the woods yet. When we look at still our state compared to areas in the world that are very significant, we heard a lot about Italy. It was very scary, but their incident numbers are half of what Canyon County's are now. So what we're seeing is much worse. I'm grateful that we've been able to manage it, but we have to be diligent if we're going to keep this under control. So I hope we do so and we have a good weekend. I'll turn it over to Travis Leach at St. Al's Nampa.
Great. Thank you, Dr. Augustus, and appreciate everybody's words of wisdom today. From a hospital perspective, there's been a lot of focus in the media and in the community around hospitalizations and capacity. And, from our perspective, that's really the result of a lot of the activity that we see in the community. We're very much on the treatment end, where we want to be on the prevention end. And so many of the speakers mentioned today, distancing, masking, making sure that we're using good hygiene are the tools we have presently. In addition to our ramp up of testing, Dr. Burgess mentioned at St. Al's we continue to drive down turnaround times and piloting same day results for some of our testing platforms. So we definitely are making headway on testing. We all know that it's nowhere near enough. But the biggest thing we can do is prevent spread. And as mentioned in Canyon County, we're one of the hottest spots in the United States right now, which is alarming. And again, those are the tools we have, which are distancing, masking, and hygiene. But we can go out there and be safe. We can, make sure that we're using all the precautions and use it wisely. We've learned a lot as the pandemic has progressed. But every single opening or holiday, we've seen a bump in cases, and I think everybody on the call would definitely nod to that. We saw it after Memorial Day. We saw spikes after the 4th of July holiday, and we anticipate a couple weeks after Labor Day here that we would see the same type of spike if we don't use our precautions. So we're concerned about that. Obviously, we're concerned about the ramifications of school openings and what that may do also to the rate, not just in children, but the secondary infections with those that are at home and seniors that take care of kids, grandparents. So we want people to celebrate. We want people to end summer in a great way, but we also are pleading with you to be careful and use good hygiene. We definitely have seen a reduction. By no means where we want to be in Ada County. We're not there in Canyon County yet. We hope to follow suit. But again, our key takeaways are mask up, keep your distance, especially with those that you don't normally congregate with, stay away from large gatherings, and take good care of yourself and use good hygiene.
Great, thank you all so much. And I'll let you know that we'll try to send the slides out, including those from Dr. Kaiser. I know that you folks couldn't see them, so we'll make sure to email those slides to you after this. So now we're going to open it up to questions. If you have a question, please again raise your hand, and when I call on you, state your name, what organization you're from, and then who you'd like to direct your question to, since we have a lot of folks on the call. We'll start with Audrey Dutton from the Idaho Statesman.
Hello, good morning. Audrey Dutton from the Idaho Statesman. This question is, I suppose, for St. Luke, St. Al's. I mean, it could be for anyone. I'm wondering if you all are seeing any long haulers, people with symptoms that are continuing for weeks or months after their diagnosis.
Well, I'll take that and pass it around, I guess. This is Patrice Burgess from Saint Alphonsus. We do have folks at each of our facilities, I know, that have been in the ICU for long periods of time, but I think you're also talking about after they go home and have lingering symptoms. And we're learning more and more nationally about some of the after effects of the infection. And so at St. Alphonsus, we're just about to open up, actually today, a COVID clinic dedicated to caring for folks that, as I think Dr. Peterman mentioned, just like primary health and I'm sure other facilities, we're trying to keep some of our clinics clean clinics, but we have patients that don't just need to go to an urgent care, but they need ongoing care that are still positive for COVID. So we're working on that clinic being available to folks that might have lingering symptoms. And you're absolutely right, we are seeing quite a few different things that just drag on, fatigue, some neurological symptoms as well.
Yeah, this is Rob Cavagnol from St. Luke's. I'd say similar experience. It seems to be more prevalent in folks who spend a long time in the hospital, a long time on the ventilator, seem to have those folks who have more severe disease. They're taking a lot longer to recover than they would, say, from just a simple pneumonia. So yeah, we're seeing that in a small percentage of patients. And like everyone else, we're still learning and trying to understand what's the best way to care for these folks.
We'll go ahead and open it up to Alejandra, followed by Ariana.
Good morning, everyone. This is Alejandra with the Idaho Mountain Express. My question is regarding antibody testing, specifically lateral flow testing versus PCR testing. In Ketchum, we had a localized antibody testing that was initially started early on and then asked to be ceased by the government, and it started again earlier this month and has once again ceased due to CMS saying that they were testing inaccurately. So I'm hoping you guys could talk a little bit about the accuracy of lateral flow testing versus some other sort of antibody testing, not sure if PCR or something else, and whether or not those results can accurately be relied upon. And this could go to anyone. I see a lot of smiling faces.
Well, this is Patrice. I'll jump off again. You know, we don't have, I don't think, on the phone the lab experts. So there are physicians that specialize in laboratory medicine, and I don't think any of us are those physicians, but maybe someone else knows more about lateral flow versus PCR. What I wanted to say was a more general comment about antibody testing. Unfortunately, it's not a terribly helpful. It's a more of a curiosity of what's going on in the community. But we now have several instances where we've heard around the world and in the U.S. of people getting infected again. So having a positive antibody test means that you're infected or exposed, but we don't know yet if it means that you're protected. Unlike other diseases where a positive antibody test usually means that you're immune and you're not going to get the illness again. But we don't really know that about this. We're still learning so much. So that's one of the bigger problems with antibody tests. And then the other problem that I think you're alluding to is there are other coronaviruses out there. So if the test isn't designed properly, it might not be specific enough to catch the one that causes COVID-19, but it might be also catching other coronaviruses. So that's my overview of your question.
We'll move on to Ariana.
Hi, this is Ariana Piper from CBS 2 News in Boise. This question is kind of directed at Dr. Augustus or President Leach, but now with BSU opening up recently and all the college students are flooding back to campus, are you guys are you concerned about this? Do you think that the cases are going to spike? Like, what are your thoughts on that?
So it is likely that we'll see some increases in cases. If people would do the simple things, but we know that young people are relatively impulsive and have a hard time with long-term delayed gratification. And so, yeah, it's going to happen. And can we manage it? Yeah, if we do contact tracing and we have appropriate testing available, we can manage these patients. But it does become incumbent on all of us to try to limit our contacts, make sure that we wear masks appropriately and we wash our hands and do good hygiene. Otherwise, we're going to expose more people to it.
Yeah, and this, Travis, I would say the same thing that we said to the school districts, which is, you know, the only way we can completely prevent infections is not having people come in close proximity to one another. So there is going to be some positive cases coming out of school opening. We know that. The question is how much, the question is how big is it going to be, and what can we do to mitigate it at this point?
Would anyone else like to comment on that question? So we have more time if anyone else has additional questions. While we're waiting for another question to come in, I'd like to know a little bit more about what your organizations are seeing from school districts now that we are seeing some positive cases happening in places like Twin Falls, and your direction for school districts when they are directing students and parents to healthcare organizations for notes for students to return to school, and whether or not that's something that's appropriate for healthcare organizations to be doing at this time based on testing supplies.
Anita, this is David Peterman. I can speak to some of your points there. First of all, just again, most I think are aware of this. I'm the chair of a committee of many of the physicians that are on this call, which is a committee of physicians that are trying to provide school districts with the best available scientific information so that school districts can make the best decision for the students. Our committee feels very strongly that we want students in schools for all the right reasons, but we're also concerned that it has to be done properly, and if it's not done properly, it's not safe. A couple of comments about what that committee has done, which is, first, we've created a statement of principles in terms of how we think decision making should be made. That is what it's based on. And we've released that in a press release, and if there's anyone on the call who wants it, I can send that to them. Second, a number of us have been communicating with school superintendents and also commissioners or board members of school districts. And frankly, I think all of us have tried to keep this, in a sense, out of the press, because this becomes, as we all know, such a hot issue. We're trying to give information to the schools to, one, so that they can make an educated decision, and two, give them guidance so that they can make decisions in a sense, non-political, not an environment where people are so upset. Then I would also say, to this point, certainly we at Primary Health have identified already positives from the schools in our area. And again, the newspapers, some of you have identified positives in the schools. So I would reiterate what is said. There will be positive cases with children going back to school. It's not when it's not will there be, it's more like when. And that's why it's so important that this is an ongoing process in the schools, in which they have to figure out how they get the children in the school, how do they handle hallways, what is the distancing in the classrooms, how do they cohort, are they coming on staggered days, how will they do meals, all of these different things, and how do we do a combination of in-classroom and remote. The challenge here is today's plan needs to be adjusted tomorrow for the data that comes in. And this is a lot to ask of our schools, because their primary responsibility is to teach our children. And now we're asking them to, frankly, take on public health measures. And so again, I come back to the physicians on this call that are trying to provide schools with the best information.
Ariana from Channel 2, go ahead.
Hi, one more question, and this is kind of for anybody who has any insight or wants to answer. But my other question was just, how are the COVID concerns in Boise versus Eastern Oregon? Are they kind of the same? Are they different? Does anyone have any insight on that?
Ariana, can you be more specific about what concerns you're speaking about?
Yeah, just if there's more spikes in Oregon versus Boise, or if you feel kind of like what you guys were saying, it seems like the numbers are going down in Boise, but that doesn't mean that they won't go back up, and we have to be, aware of that. So if there's just any insight on that.
This is Travis from St. Alphonsus. I can tell you that Malheur County, we do have a hospital over in Ontario, Oregon, is as red or more red even than Canyon County in terms of infection rates. So they have a very high prevalence, much smaller population, but definitely a high rate of infection there, and then probably followed by Canyon County and then Ada, right in that order, from what we've seen in the data so far.
I'll follow up with that question related specifically to Labor Day. Is there any sort of data that we saw specifically from 4th of July, obviously Memorial Day we mentioned, but what can we see in the data from the past holidays and what that could mean in combination with schools coming up and the Labor Day holiday?
Well, this is Patrice again. I'll just mention also after Father's Day, and any time that people gather as has been mentioned, that are not normally in the same household, and you start to exponentially expose yourself to folks that have been exposed to the virus, that's when we see spikes. So again, you've seen the governor's recommendations with crowd sizes, trying to keep those sizes small, trying to limit to your own household. And then if you are around people not from your household, to wear a mask, wash your hands, do all those things. So each of those holidays, I think, created opportunities for people to gather in larger groups, closer together, let their guard down a little bit, everybody's tired and wants to get back to normal. And I think those holidays bring upon that sense of, oh, I want to have my normal 4th of July, I want to have my normal Labor Day weekend. And unfortunately, we still have to be cautious. It doesn't mean we can't go out and have fun, but we have to do it within those parameters.
Would anyone else like to add to that?
This is Travis. I just want to add, because I think when we talk about large groups, there may be a little bit of a misconception. We try to figure out when we either have a colleague or a patient that does present and is ultimately diagnosed, where that came from. And when we say community spread, we're not talking about gatherings of hundreds of people. We're talking about backyard barbecues with 30 people. And I see a lot of head shaking for those on the call also. That's the level we're talking about here. A lot of people that don't know each other congregated in small spaces, and for whatever reason, not masking or distancing. That's where we're seeing the majority of our infections coming from.
Hey, Anita, this is Rob Cavagnol from St. Luke's. So, we might be tired of the virus, but the virus isn't tired of us, and we have to continue to be diligent. I think what's coming up is potentially a dangerous mix, right, of schools getting back in place, the holidays. If we have a run of cold weather, all those things might be coming together and could actually be a significant fuel on this fire. So as already has been mentioned, we have to continue to be diligent in doing these things. And this might go on for several more months. We can't be putting all of our hopes in, a vaccine's going to be out real soon and it's going to take care of this. This has to just be ingrained in our everyday behavior. Every time we go to the store, we put a mask on. Every time we come home from school, we wash our hands. All of those things just have to become new normal behaviors.
Thank you for answering that question. We have just a couple of minutes. Are there any additional questions that any of our journalist partners would like to ask while we have these leaders gathered here together? Please feel free to raise your hand or just jump right in. Okay, we're not hearing from anyone, so I just appreciate everyone taking the time today, and again, for stressing the reminder about Labor Day and then the testing capabilities and who is eligible for tests. If you have follow-up questions, please send them our way. We're happy to connect you with our leaders on this call. And if you feel like you have a question that maybe didn't get answered today, but you'd like to follow up with us, please let us know and we'll be sure to do so. Thank you.
Thanks, Anita.
Thanks, everyone.
Bye-bye.
Thank you. Thank you.